Good morning, and we have started. Hello. It might be afternoon for you. I don't know where you're logging in from. So welcome to the Viome webinar today. We're so happy to have you here. What I'm going to do is I'm going to just wait a few minutes for everybody to come on into the Zoom room so we can get started with the bulk of people that are going to join. But while we do that, what I would love for you to do, if you see that little chat box at the top or the bottom, depending on where your bar is for Zoom, just click on that and let us know who you are and where you're logging in from so we can get to know you a little bit better. While we wait for some other people to join, go ahead and do that. Hi, Michelle from NorCal. Great to have you here. Catherine from Connecticut. Oh, lots. It's going now. Tomas from Canada. Welcome.
Ooh, got someone from Hawaii.
Excellent.
Nice. Wish I was there.
I know, me too. Me too. Holly, hi. So one thing I also want to do while we wait as well is, so this webinar is entitled Healthy Mouth, Healthy Body, How to Design the Right Routine for Your Oral Microbiome. But I want to point you to another webinar that we had in the fall, I believe, and let me get to that slide here. So that webinar was the importance of oral health for full body wellness. And this was a fantastic webinar. We went over some great scientific and nutritional data. You see these three gentlemen right here who put together this webinar for you. You may be familiar with them if you've joined us before. But where you can find this webinar and all of our webinar content is YouTube. So I want to point you out to youtube.com/Viome. And the playlist specifically is Viome Live Webinars. And you click on that, you can find this, or you can find any of our webinars, our content webinars that we've held on a monthly basis for probably the last year and a half. It's a good catalog. So go on in there and log in. You can find this webinar for a little bit more information on oral health. But today we're going to concentrate on your routine. So let's just look and see who else is here before we get started. Yeah, and so we have
Denver.
Huh? What?
Denver. I just moved.
Denver. Nice. Then we have Lucia from Honduras. Wow, that's a little ways away. Excellent. Thank you for joining us.
Florence is from
Betsy.
Argentina.
Oh, wow.
It's so fun to see where everyone's from.
Nice. Bessie is from Dallas. Another Vernon from Canada. And let's see. You know what, Amanda, sorry, I should have been prepared with a link to the YouTube. I apologize. But if you go onto youtube.com/@Viome, you should be able to get there. Next time I'll try to do that. Oh, look. Janelle put the YouTube channel in there with the playlist. Thank you so much. I appreciate that. So if you want to flick through the Q&A really quickly, you can see Janelle's link right there. I'm handling a few things at the same time, so it's a little bit easier for her to put that link in there. Thank you so much. All right. Well, I think what time? Oh, yeah, we can definitely get started. And so what I'm going to do is I'm going to move to our next slide. And so for Healthy Mouth, Healthy Body, we have three amazing individuals here with us today. One who is brand new, and I'm very excited to introduce her. So first, I would love to introduce Janelle Connell, Translational Science Clinical Expert at Viome, and Hilary Kaiser, Translational Science Nutritionist Supplements here at Viome. And brand new to the Viome team is Loren King. She's our Director of Education and a registered dental hygienist. I'm so happy to have you on the team and really happy to have you on this call here today. Hi, Loren.
Hi. I'm so excited, and webinars are a great way to spread the masses in education terms. And so I'm so excited that Viome takes advantage of that and that you guys let me come hang out with you today.
Awesome. So glad to have you here. And this is a fantastic group of people who's going to give you some really fantastic information today. And so the first place that we want to start off is oral health and why it's so important. Is that right?
Yes.
Yeah, let's start there.
All right. So there we go. Let's start off.
Sure. Why is oral health so important? If you have been testing with Viome, or even if you've just been following Viome as a company, You probably know by now that we're all on a mission to make illness optional. It's what we wake up every morning for. We get out of bed, we can't wait to come to work and work on this problem. Because we know health is our most valuable commodity that we have in this life. And the truth is, a lot of us struggle with it. But through proper nutrition and supplementation, we at Viome believe that chronic diseases can be prevented. So then, as a company that's so focused on this mission to prevent diseases, why on earth would we care so much about a sparkling smile and fresh breath? Well, I can promise you it's not a matter of vanity. It turns out that having excellent oral health is actually much more meaningful to your overall health than you probably might think. And let me tell you why. In our mouths, your oral cavity, there are nearly 700 species of microbes. We call this your oral microbiome. It is the second most abundant and most diverse microbiome in your body after the gut microbiome, which you're probably familiar with. We talk about a lot. Now, these microbes, they're all over your body. They coat every surface of your body and every surface of your mouth, your tongue, your teeth, your gums, your throat. They're even mixed in with your saliva. They especially like those little tiny cracks and crevices in between your teeth and your gums where they're protected. They can thrive there. Now, when this oral microbiome is healthy, it can provide a whole bunch of really beneficial functions for your oral health, like it can protect you from pathogens, can protect you from developing cavities, bad breath, and even from gum disease. Now, these benefits even extend beyond your oral health for the rest of your body. For example, when you chew and you eat your food, you're mixing the food with your saliva, and the microbes in your saliva are starting to pre-digest your food for you. And from your food, they can produce essential molecules for your health. Just for an example, nitric oxide. This is an important molecule in regulating your blood pressure. So they're really active in your mouth, doing a lot of things, not just in the oral cavity, but for your whole body. But what happens when it's out of balance? Well, if it's out of balance, this means that the microbes in your mouth likely are performing not optimal functions, or perhaps there is a higher prevalence of oral pathogens, the so-called bad guys in your mouth, a higher prevalence of these bad guys than the good guys, the commensal bacteria. And when this is out of balance, it can be detrimental to your oral health. So what are these bad guys doing in there? One of the notorious oral pathogens is Streptococcus mutans. If you've ever had a dental cavity, chances are this microbe was the one working to make that dental cavity. It lives in biofilms on your teeth, especially those cracks and crevices that I mentioned. It likes those cracks and crevices because food gets stuck there. And it can metabolize leftover sugars and starches that are left in your mouth from the food that you eat. And from those foods, it produces acids that can erode your teeth and cause cavities. It also produces plaque. You probably heard of plaque when you go to the dentist, right? They scrape the plaque off your teeth. Well, plaque provides a really sticky surface for more bacteria to come and adhere onto, a little bacteria party. Who else is there in the mouth, the oral pathogens? Porphyromonas gingivalis or P. gingivalis. This is the main bacterium that causes gum disease. So if it's in the early stages, we call it gingivitis. If it's advanced stage periodontitis, this bacteria can produce a whole bunch of not beneficial molecules, like for example, lipopolysaccharides. Those can cause inflammation in your mouth and even the rest of the body. And it can also produce a whole bunch of other virulence factors and enzymes, which if left there over time, they can erode your gums, your teeth, and even the bony structures that hold your teeth in place. So
One thing I'll add to that, Hilary, with that, because this is new information with P. gingivalis, they've actually proven that it now breaks the blood-brain barrier and causes Alzheimer's. So there's a direct link. It's no longer a question of whether or not it's possible or whether or not it's happening. Periodontal disease is a direct link to Alzheimer's, as well as any type of airway or sleep apnea issues that you may have on top of that, which we deal with in oral health now as well. That can also contribute to it. So that nitric oxide that you were talking about earlier is going to be detrimental in making sure that things like that don't happen, and that we are going to get through our nose. But in our oral cavity, P. gingivalis is something that is a direct link now too.
yeah, absolutely. So possible, or it seems very likely, connection between oral microbes and your cognitive health. We'll talk a little bit more about some other connections just in a second, but I wanted to talk more about what some of these oral pathogens, what else they can do in your mouth. Some of them, they can also metabolize compounds in your food, like sulfurous compounds in your cruciferous vegetables, your broccoli, your cauliflower. They can metabolize the polyamines in fermented foods. And when they do that, they produce highly odorous byproducts that can contribute to bad breath. So unless you are testing your oral microbiome, you'll probably have no idea that any of this is going on. I mean, maybe you could smell your bad breath, or hopefully you have someone in your life that would be generous enough to tell you if you had bad breath. But otherwise, an estimated 90% of dental infections have no pain. So no pain, nothing's going on, right? Well, it's not always the case. Now, we know that your mouth is the gateway to the rest of your body, right? But there's really only a thin layer of protection between the microbes in your mouth and the rest of your body. Every time that you swallow, the microbes in your saliva can make their way into your stomach. It's a very acidic environment in your stomach. This acid in your stomach would normally kill your oral microbes, but in some cases, if you have perhaps low stomach acid or you're taking PPIs, some of these microbes can actually survive, and they can make their way into your lower digestive tract, perhaps even beyond. Now, if you have gum disease, tooth decay, any cuts in your mouth, these oral microbes can easily make their way into your bloodstream, right? It's open sore, open wound. It's a straight shot into the bloodstream. And then once they get there, they just circulate around in your body. Next slide, Lisa. So Loren already mentioned one of the connections. Research is really now only beginning to understand all of these connections between our oral health and our systemic health. And what we're finding, at least here at Viome from our research, is the health of your mouth is really a mirror to the health of the rest of your body. If you have poor oral health, it's likely that there's other issues happening in the rest of your body. So I'll give a few examples. We talked about brain health, P. gingivalis. It's been found in the brains of Alzheimer's patients. But what about gut health? What's the connection there? There are several studies now that have shown there's a positive correlation between gum disease and inflammatory bowel diseases. Also colorectal cancer, the presence of the oral pathogen Fusobacterium nucleatum. It's been found in the guts of colorectal cancer patients. And we know once it gets there, it can promote tumor development, and it promotes a really inflammatory environment. So that's not good for cancer. Pregnancy. Oral microbes do not cause pregnancy, but oral microbes can cause adverse pregnancy outcomes. Ladies, when we're pregnant, our gums become a lot more permeable. So your oral health is especially important during this time in your life. Nearly 60 to 70% of pregnant women have gingivitis because our gums get so permeable. It's really easy for those pathogens to get in there and take hold. Now, if this gingivitis is left unchecked, it turns into the advanced stage periodontitis. Periodontitis has been associated with preterm births and low birth rate, so it can even affect baby too. And heart health. So heart health, big topic. We talked about it last month in our webinars. It's the leading cause of death in the United States. There's an estimated 630,000 deaths every year due to heart attacks. And scientists now believe that 50% of those heart attacks are triggered by dental infections. So that means about 315,000 deaths a year could potentially be prevented. Next slide, Lisa.
Oh, poll time. All right.
Have we done the poll yet?
No, we have not. Let's do that.
Yeah, so we'd like you to fill out this poll. It's completely anonymous. We want to get to know you in the audience, what your age is. We're not going to keep a record of it, but I want to kind of use these statistics to demonstrate the magnitude of this issue.
Okay, we're rolling. The answer's still coming in. Okay. All right, looks like we're done. I'm going to share the results here so we can just see what the demographics are on this call. So it looks like the highest percentage is 30 to 64 years.
Okay, 30 to 64 years. So there's about 78 people on this call, or at least people who responded to this poll, saying their age over the age of 30. Well, if there are, 78 people. So according to the CDC, 47% of Americans over the age of 30 have gum disease. So that means about 37 people on this call, statistically speaking, could have gum disease. Now, 56 people over the age of 65. So not great news. Over the age of 65, it jumps up to 70% having gum disease. So about 40 people on this call potentially could have gum disease. If you're under the age of 30, well, lucky you. The CDC hasn't published a statistic on you yet. So keep brushing your teeth, keep up the good oral hygiene, and hopefully you won't become a statistic. So it gets a little bit more stark. Furthermore, people with gum disease are nearly twice as likely to have heart disease, according to the American Academy of Periodontology. So these are statistics. Just because you are over the age of 30 or 65, it doesn't mean that you have gum disease. It doesn't mean that you're going to have heart disease, but there is a risk, right? So my intention isn't to scare you with these associations. It's really to empower you, right? Knowledge is power. So now that we know, the silver lining in it all is that all of this is preventable with proper nutrition and proper hygiene. Viome is now offering oral microbiome testing. We launched our full body intelligence test last year, and that includes an oral microbiome test. And soon, coming later this year, we're going to offer the oral microbiome test as a standalone product. So if you're only interested in what's going on in your oral microbiome, we've got you. Their testing is super easy. It's just a saliva sample. You spit in a tube. We send you the packaging, mail it back to us. We take care of all the rest. You get your results in your app and your nutrition program. So it's not too late to dial in your oral hygiene, your personal nutrition. We have the fabulous Loren King here. She's going to give us some more tips on how we can best take care of our oral microbiome. So over to you, Loren.
All right. Oh, Loren, you're on mute.
Whoops. My background, as you heard earlier, is I am a registered dental hygienist. I'm also an international speaker, and as they were saying, the director of education here at Viome. So I am fully convinced that education saves lives, and it is not your fault that you don't know what you don't know. And so my job and everyone on this call's job is, or this webinar's job is to help you and make sure that you have the tools and the education that you need to take care of yourself. A lot of this stuff isn't taught in our schools, especially depending on, what part of the country you're from. It's even less important. I grew up in Memphis, Tennessee, and I will say that our health is probably one of the least concerning things when I was growing up. It was more so, how are we going to get food on the table and things like that. So you don't know what you don't know. And that's why we're here. So with going through this hygiene routine, I'm going to give you a perspective of basically what I would talk to my patients about and what I would suggest to them when I was still in clinical practice and things of that nature, so that you can, one, have an understanding of why things happen in the mouth, but also what to do in those scenarios. So we're going to start with brushing, and there's a lot of different information out there of when you should brush, how you should brush, what you should brush with. Hopefully it's not wires and wood like we used to do. A lot of my patients would have this mentality of, if I brush with one of the toothbrushes that has medium or hard bristles, then I'm going to be doing a better job. And I would always joke with them and say, listen, I promised my parents I would never end up on the news. So if I could, I would go take all of them off of the shelves because they are just there to make money. Please do not use anything past soft. So extra soft or soft is the only thing that you want to be using. But I can't go take all of those off the shelves because I'll end up on the news. So just use extra soft and soft because your gum tissues are very, very tender. They're very, very sensitive. And I know it makes sense mentally, when you think about it. So, it's the harder I brush or the tougher anything is that I use is going to get more off. And it's actually going to do more harm than it is good, because it is going to, one, disrupt the tissue attachment to your tooth. And it's going to make it to where bacteria can get into your gum tissues much, much easier because they are inflamed and they're slightly or microscopically pulled away from the teeth. So we don't want to use that. In terms of how often you should brush, we tell you twice a day, in the morning and at night. If you're only going to brush once a day, we actually recommend that you brush at night. That way you're not going to bed with anything stuck on your teeth throughout the entire day, because once you go to sleep, your oral cavity becomes a dry environment, and that is the perfect environment for bacteria to thrive on. So we want to make sure that it's as clean as possible before that change of environment happens, so that we're not making anything worse. We can go ahead and go to the next slide.
Hey, Loren, can I chime in here real quick?
Yeah.
We did get a question of, what about electric toothbrushes? Do they tend to be harder, or can you still use those?
Yes. So actually, what we were going to dive into a little bit next is with the routine of brushing and what you should brush with, which is the next slide. So you actually do want to use an electric toothbrush. If you are not, I would highly, highly encourage you to go ahead and switch, because the statistics behind it is it would take you about a year to match the brush strokes of an electric toothbrush compared to a manual toothbrush. So it's just a night and day difference. As soon as you start using one, if you go on vacation or if you forget it or something like that, you're going to be upset because you're going to be missing that toothbrush, because it's such a different feeling. It also helps with, if flossing isn't going very well, it's pushing the solution microscopically in between each tooth surface. We're going to get into more of that in just a minute, but yes. So electric toothbrushes, I swear by them. It bridges that gap between human error. But with their bristles, they're actually really good at making sure that they're not selling anything that is going to be bad for you. But if you buy like the off-brand ones on Amazon or something like that, because you should be replacing your brush head every 2 to 3 months. If you have an electric toothbrush, and that means you should be changing your manual toothbrush every 2 to 3 months, because essentially what is happening if you don't is past that 3-month mark, you're essentially just brushing with bacteria. You won't be able to see it, but that's the amount of time it takes for it to start to accumulate on the bristles. So that's going to be a huge thing. But if you buy the ones on Amazon to, you know, save money or buy them in bulk, just make sure that they're extra soft or soft, because anything past that is not going to be good for your tissues. We have a funny video here, and then I see some other questions over here that I'll answer.
I love this video.
Just whatever you can find, right? It's like sometimes you're in the middle of nowhere and you just need to use the tip of your finger in your toothpaste. It's like, hey, I'd rather you do that than nothing at all, to be honest with you, as a hygienist myself. So with these questions over here, so there's a few of them. Twice a day, I've been taught 3 times a day. It honestly depends on your lifestyle. It depends on your diet. If you are someone who snacks throughout the day, especially if it's fermentable carbohydrates, or if you're sipping coffee throughout the day versus just drinking it all in one sitting, then yes, I would recommend brushing 3 times a day, morning, lunch, afternoon, because fermentable carbohydrates, snacking throughout the day, sipping anything with sugar or that could stain your teeth throughout the day versus all at once, those are all going to be detrimental to the oral cavity, which is also your oral health. So it would more so be, let's talk about your diet. Let's talk about your routine. And then looks like we have, how about Sonic? So the Sonic Air toothbrush is great. It is just one of the few products. Oral B is another great one, especially if you have a smaller mouth or more narrow arches. It's the only one that is going to have a round brush head. So you're really going to be able to get in there. But to be honest with you, anything electric that has, I would encourage you to look at the reviews and things like that. But anything electric is going to be better than a manual toothbrush. Just the brush strokes alone and how much more you're getting is going to make a huge difference. And
Lauren, I've heard that the average person brushes their teeth for 30 seconds. Is that long enough?
No. So it is better to do than nothing, of course. But we recommend 2 minutes or somewhere within that range, just because if you think about it, you're not spending enough time in each quadrant of your mouth. So you have 4 quadrants in your oral cavity, and we want you to spend adequate time in each of those quadrants, which is another good thing about the electric toothbrushes is a lot of them now have timers on them. So it'll tell you by vibrating when it's time to switch to the next section of your mouth. Some of them will light up red if you're brushing too hard, because again, it doesn't mean that you're doing a better job. It means you're doing damage actually. So having something like that can guide you to make sure that, you know, it's not just we want you to brush, we want you to brush well, because there's so many places and things like that you could be missing. Looks like we answered this one. And I want to get your thoughts on oil pulling. So oil pulling is going to be a clinician by clinician type of answer. It has been shown to prevent cavities, gingivitis, any type of like candida or periodontitis, but it essentially helps to reduce the tooth pain. And if it's practiced regularly, it can help stimulate the tissues and cause things to heal. But with actual data behind it, it's not quite there yet. But a lot of clinicians do utilize it, and it's something that you can ask your clinician to do. And if they don't, then they might be able to refer you to someone that can. Ultrasonic toothbrushes. So that's going to go back to those electric toothbrushes. And with what if you use a UV light to sterilize the brush? Technically, there's no data behind that it would actually work because of the material of the bristles. But also on top of that, the bristles are going to start fanning out after about 2 to 3 months. So not only are we worried about the bacteria, but now that the bristles are fanning out, they're not doing their job like they're supposed to, because they're not cupping the tooth anymore. They're kind of just shaking on the side of it, if that makes sense. So we want to change out those brush heads also to make sure that the bristles are still intact and in the form that we create as clinicians and scientists, to make sure that it's doing everything that it's supposed to do. So if you want to try it, by all means, but we still want you to switch out the brush head, not just for the bacteria. Even if you do sterilize it, it's also for the integrity of the brush head itself. So another question is that there's controversy about the traditional toothpaste versus some newer alternative toothpaste. What is your thinking about these? I would need to know more about what the controversy is. If you mean by some newer alternative toothpaste like charcoal or using baking soda or things like that, which is, I think, what you're talking about. Those are fine. You can use those. They don't usually have fluoride in them. Fluoride is something that we are recommending 2 times a year. And that is going to be for a few different reasons, which we're going to dive into in just a minute. But it is something that you can use, absolutely. I would just encourage you to, at another portion of the day, like maybe using that in the morning and then using a fluoridated toothpaste at night, so that you're still getting that protection on your teeth. And it also has been shown that getting fluoride twice a year will keep a highly sensitive, meaning you have a high tooth sensitivity, a patient like that, it will help their sensitivity almost go away completely for up to 5 months after application. So that's why we recommend twice a year as well. But also with cavities, if the decay has not gone through the enamel and into the dentin of the tooth yet, then it can potentially be reversed. So we can start reversing those cavities as well. Let's go ahead and go to the next slide really quick.
Oops, sorry.
It's okay.
Apologies. There we go.
So with toothpaste, Hilary's going to dive into this a little bit with you.
Yeah, so there's really a lot of great toothpaste on the market. Instead of giving you any specific recommendations, I thought it might be more helpful to talk about ingredients that you should avoid, things you should look out for that are commonly found in toothpaste. At the top of the list, we have sodium lauryl or laureth sulfate, SLS, you might hear it as. If you've ever brushed your teeth and afterwards you've drank water and it feels really icy cold, that's the SLS. They put it in there because it makes the toothpaste really foamy. SLS is not good for you because it strips away the protective mucin layer in your mouth. You really need this. It provides a barrier between the oral microbes and your gums, your teeth. And even worse, it can slough away the skin inside your cheeks, your lips. It can cause canker sores, dry mouth. Like Loren said, a dry mouth is a breeding ground for more bacteria. And it's also been classified as a potential endocrine disruptor. So that means it can affect your hormones, which we certainly do not want. Triclosan and parabens, these ingredients are put in there to help preserve the matrix of the toothpaste to keep it from going bad. Both of these are known endocrine disruptors. They can affect your oral microbial diversity. And if they make it into your GI tract, especially triclosan, it can affect your diversity of your your gut microbiome too. Now, saccharin, aspartame, propylene glycol, these are all things that are added to make toothpaste taste good, taste sweet. Saccharin and aspartame, they are known to decrease microbial diversity too. And if there's continued usage of them, that continued usage has been associated with a whole bunch of diseases, obesity, diabetes, even brain cancer. And then propylene glycol, this ingredient, it's known to absorb moisture from its environment, so that has a drying effect on your mouth. And again, lower saliva content, have more bad breath, more cavities, more gum disease, all sorts of things that you do not want. So lots of good toothpaste out there, but just be careful of these ingredients. Avoid them if you can.
Absolutely. So it's important to know what you're putting in your body. And it's also important to know what happens if you do put it into your body. With toothpaste, I see a few questions on here. I was going through to try and see if we have any repeat questions or similar questions. And there's a few of them on here asking about toothpaste and fluoridated versus non-fluoridated. But also a couple more questions about the brush head being medium or hard or soft or extra soft. And to those questions and to speak to toothpaste as well, again, we do want you to only use extra soft or soft toothbrushes. The reason for that is because anything past that is going to be disrupting, one, your tissue attachment. It's going to irritate your gums, and it's actually going to cause trauma to the gum tissues, especially if you're brushing really hard on top of that. More vigorous or a stronger bristle does not mean it's going to clean more. So having the correct toothbrush or what we prefer as clinicians is that you have an electric toothbrush with soft bristles. You're brushing twice a day. Anything past that in terms of a brushing sense is not necessary. If you are being told to brush more than twice a day, it's likely due to your clinician being concerned about your diet or some medications you're taking that can dry out the oral cavity and cause more cavities, which is also going to create the perfect environment for any type of periodontal bacteria to thrive in as well. So we definitely want to make sure that with each individual patient, there may be some little things that we're going to tweak for you in terms of what we want your routine to be. But for the most part, it's going to be a baseline. This is considered the highest standard of care. This is what you should follow. With fluoridated toothpaste versus not fluoridated toothpaste. So if you are not getting fluoride in your dental office when you go every 6 months or however frequently you go, you at least need to have a toothpaste that has fluoride in it. The reason for that is because you need that from somewhere. Now, it's not going to be anywhere close to the parts per million that you're going to get in the fluoride that's a professional dose, but you're still going to have at least a little bit of some type of protection on your teeth and possibly reverse the decay that hasn't gone through the enamel barrier yet into the dentin. And if you have highly sensitive teeth, I definitely encourage you to use anything with fluoride in it and get it twice a year from your dentist, because I was saying earlier that the data shows that it's up to 4 to 5 months, more 5 months to help with that sensitivity significantly. So it is something that is extremely important. And in order for you to experience any of the toxic or harmful effects from fluoride, the parts per million would need to be so high that it would have to be in a professional dose for you to experience any of those things. And on top of that, it's not something that they would ever put that type of dose into any toothpaste. It is very, very minimal. If you're drinking primarily water bottles instead of drinking from the tap, especially depending on where you're located, you may not be getting fluoride as well because it's filtered out. So drinking from the tap, especially if it is in your water systems, then you can get it from that as well. I would say we can go ahead and go to the next slide. So more into your hygiene routine of flossing, using a water pick and tongue scraping. So the picture on the left you see here with the tongue, and it looks white. It looks like there's like a layer on top of it. It's essentially a layer of microscopic bacteria that keeps building up on the tongue. This is why tongue scraping every single day, once a day is fine. I do it twice a day just because that's what I do. But at least once a day, scraping the bacteria off of your tongue is going to be crucial in terms of bad breath. 90% of bad breath comes from you not scraping your tongue, unless there is a low-grade infection present from periodontal disease. Then that is going to cause a very, very specific and very obvious smell. Or if there is too much decay in the mouth, that will cause bad breath as well. If you have diabetes, or if you are utilizing a ketogenic diet, those can cause different odors from the rest of your body that can come up and out of the oral cavity with flossing. And we can go ahead and jump to the next slide really quick. So with flossing and using a water pick, and the differences and the controversy between them both. And the way that I explained it to my patients was that I want you to do what you're going to do consistently, because in terms of an oral health routine, consistency is going to be quality every single time. If you're only going to floss 2 days a week, and you're going to water pick every day because you think it's easier, then I want you to water pick every day, because every single day you go to bed, you're leaving that on your teeth. And the two surfaces in between your teeth cannot be cleaned by anything other than floss or a water pick, to the extent of actually removing the bacteria or removing any food that might be impacted in there. So one thing that you see over here with the studies is that they've actually proven now that the water pick or water flosser is 29% more effective than string floss for overall plaque removal. And it's again going back to its high pressure water in between those two surfaces can also push out impacted food much better. And a lot of times people don't floss correctly. So they're just popping it in and popping it out. And that's not really getting that much in terms of microscopic bacteria, because there's millions and millions in between your teeth. But you essentially want to make a C shape around your tooth. And I usually tell my patients it's like you want to towel that side of the tooth off and then wrap it around the other tooth and that surface, and then do the same thing. So if you're not doing it properly, then it's also not going to be as efficient. So with the water flosser, I always would tell my patients to purchase the cordless one. And the reason for that is because if it's cordless, you can put it in your shower. And I'm assuming you bathe every day, so you're going to see it and remember to use it. But also, if you make a mess, it doesn't matter because you're standing in water. So do that. And I guarantee you will start seeing a huge difference in any type of bad breath or bleeding. A lot of patients will say, well, I only bleed when I floss. And that's because it's an inflammatory response that your body is rushing blood to a specific area where bacteria is present, and it's trying to flush that bacteria out, but your blood isn't strong enough or thick enough to do that. So until that bacteria is removed and on a consistent basis, it's going to keep bleeding. So anytime that that's disrupted, meaning you're flossing and you're putting stimulation onto those tissues that are not used to that, and there's bacteria present, it's going to rush blood as an inflammatory response to that area. So typically what we see is after 10 to 14 days of consistently using the water flosser or floss every single day, at least once a day, the bleeding will stop unless there's an undiagnosed periodontal condition. If there's active periodontal disease under the gum tissues that has calcified to the tooth surface, it is not going to stop until that bacteria is removed from under the gum tissues. So going in for your regular checkups is extremely important so that you can find out if it's your home care that's not going well or if there's an actual low-grade infection under your gums. And we can jump to the next slide. With mouthwash, I saw this question being asked a couple of times. So the biggest thing about mouthwash is reducing the bacteria count in the mouth. So we want to create as close to the most perfect environment possible on a daily basis so that we can maintain our health and also not, cause any new problems that can be prevented. Mouthwash is one of those things, but the one thing to keep in mind with mouthwash, and Hilary's going to go over a couple of ingredients to be aware of, is you want to stick with something that has or is a non-alcohol mouthwash. And the reason for that is because there's been studies that have shown that the repeated exposure to that level of alcohol on the tissues can cause abnormal tissue regrowth because the tissue is having to regenerate itself so quickly, so often that it is basically not doing it correctly in a sense. And so it's causing abnormal, which could lead to malignancy type of issue with tissue change. So, and it also can cause the tissues to slough, which we're going to show you as well. So with sloughing, this is going to directly come from alcohol being present, tissue degeneration, but the main cause for it is the sodium lauryl sulfate that we were talking about earlier, the SLS. So that's present in a lot of the toothpaste now. It used to just be the big names, but a lot of them have it now. And it's not that it is bad for you. It's just that some patients, and as you see in this photo, they have a high sensitivity to it, almost like an intolerance or an allergy to it. And so what we recommend when we see this is, hey, switch to a brand that doesn't have SLS in it. After a couple of weeks, this problem should stop. Another thing is if you're using a whitening toothpaste with SLS in it on top of that, this is usually exacerbated because not only is the SLS that you have a high sensitivity going to do this, but some of the whitening toothpaste you can be allergic to or highly sensitive to as well, depending on the brand. So if it's an extreme case of sloughing, we usually can assume and ask, the patient will find out quickly, are you using a whitening toothpaste? Is it this brand? Does it have SLS in it? Then that's why this is happening so bad. So it's going to come from your toothpaste primarily with SLS. With the next slide, we're going into the ingredients of the mouthwash, and a lot of these we talked about in toothpaste, but it's just important to know that the ingredients that Hilary went over earlier in toothpaste are also in your mouthwash. So you want to be cognizant that it's not just one product in your oral care routine. It might be multiple, which means you're getting multiple exposure to those ingredients. So Hilary, was there anything else you wanted to speak to with that?
No, that's perfect, right? Same ingredients to look out for in mouthwash as toothpaste. I might add to that list, look out for artificial colorings. Those seem to be a little bit more used in mouthwash than toothpaste. So just be aware of what's going in your mouth, what's going in your body. Look out for these ingredients.
Yes. Another thing is going to be speaking towards hydration, making sure that we're drinking adequate amounts of water every day and keeping the environment as far away from being a dry environment as possible, especially if you take certain medications that cause dry mouth. Then we usually will suggest that you use some type of supplementation for that, like biotin or something that's going to help mitigate you having like a clinical degree of dry mouth. You would need to use it every day though, because it's supplemental. It's not going to get rid of the problem. So those are some options as well. Making sure that you're staying away from anything acidic, especially if you're someone that likes to sip your coffee throughout the day versus, you drink the whole cup within an hour or whatever. With me, and I'm bad Loren or whatever you want to say is with red wine. So I like to let it pool in my mouth and then I swallow it, which is what you are not supposed to do. So don't be like me. But if you are, just make sure that you are doing other things like we've talked about to mitigate those problems. We're going to dive into whitening here in just a second, which is going to speak to the types of things in your diet that may cause certain things. But you want to make sure that you're staying away from anything acidic, anything high sugar, and anything with artificial sugars as well. And, it's honestly, it's enlightening to be a dental professional or an oral health advocate and see that so many of these companies have started going to zero sugar or, like the carbonated, no sugar, no carbs, no calorie beverages, but they have artificial sweeteners in them, which you want to be careful about. But at the same time, it's better than you consuming 50 grams of sugar or 50 grams of carbohydrates. And that's in one drink. So I hope you're not eating or drinking anything else the rest of the day. But it's over time, we've become educated as human beings of, this is really bad for me. And why am I drinking this or why am I eating this? And which causes those companies to lose money, and they have to pivot and start providing options that we are educated and know that are actually good for us. So it's a great time to be alive, folks. But with the next slide, this is a good video for you guys to watch really quick.
All right, let's go for this. Whoop, sorry, my volume was turned off. I'm just going to start it over again.
Sugar we consume, certain microbes can overpopulate and cause cavities. Diets high in sugary foods cause an explosion of bacteria called mutans streptococci in our mouths. Like humans, these microorganisms love sugar, using it as a molecular building block and energy source. As they consume it, the bacteria generate byproducts in the form of acids, such as lactic acid. The mutans streptococci are resistant to this acid, but unfortunately, our teeth aren't. While each human tooth is coated in a hardy, protective layer of enamel, it's no match for acid. That degrades the armor over time, leaching away its calcium minerals. Gradually, acid wears down a pathway for bacteria into the tooth's secondary layer called the dentin. Since blood vessels and nerves in our teeth are enclosed deep within, at this stage, the expanding cavity doesn't hurt. But if the damage extends beyond the dentin, the bacterial invasion progresses, causing excruciating pain as the nerves become exposed. Without treatment, the whole tooth may become infected and require removal, all due to those sugar-loving bacteria.
All right.
So that's a deeper dive and a great illustrative tool in terms of just breaking it down for you, what causes it, what it looks like in terms of the process. But if we go to talking about whitening, a lot of times I'm asked, is it something that I should be doing all the time? Should I be using whitening toothpaste? Should I be using whitening mouthwash? And I always make sure that I educate you guys first, because a lot of patients don't know that any whitening product over the counter is only going to be strong enough to get the last 24 hours of stain off. It is not strong enough to get anything past that. So it's more meant to be something the strips or the gel, then you want to make sure from that day that you can use the whitening products every day to keep that, so to maintain that shade. Otherwise, it is not going to get anything else off past the last 24 hours. All right, so that was pretty much everything on my side of things. I'm going to go through while Janelle and Hilary are going through this next section quickly to answer some of these questions over here to you guys individually. I'll write them and send them to you.
All right. So Janelle, next slide, hun.
Yeah, let's look at it. Thanks, Loren. I know we've gotten.
Oops, sorry about
that. We got our video again.
This is not, I'm just, there we go. Now I've got it. Sorry.
Yeah. So many good questions coming in. I appreciate them. It's fun to see those and what's on your guys' mind. I get the fun part. I get to talk about food, right? Not about brushing your teeth. Loren and Hilary both highlighted a lot. And so hopefully I won't go too deep into that again, but there's definitely some things with what we eat, right? Our food is exposed to our mouth. Those oral microbes get direct contact with that food. It makes a difference. It impacts the pH of our mouth. So there are practices that are good for all of us, but of course we're Viome and we want to know what's right for you. So we do take it the next level as well and look at what impacts your specific microbiome. Go ahead to the next, let's see, what's on our next slide? Yeah, there we go. So we've talked about sugars a lot. The video highlighted sugars and what it does, you know, are those S-mutans, the bad guys in our mouth, they love that sugar. They're going to use it to create acids, which will erode your teeth. Similarly, if we're eating or drinking a lot of acidic foods, it's going to have the same impact. I have the picture of the soda here. I think that's like our classic number one culprit, right? Is that it's an acidic food, it's a sugary food. Even if you're choosing a diet soda, those artificial sweeteners, like has been highlighted already, those impact your oral microbial diversity. So still not good. When it comes to anything that is sugary or acidic, besides limiting it, you do want to also make sure that you're just taking care of your microbiome and your oral cavity during that time. So using a straw might be a little bit more helpful. Drink it quickly. Don't let it sit in there, like Loren said. And if possible, you want to swish around some water and rinse afterwards, and then wait that 30 minutes or so before brushing, because once your teeth are exposed to the acid, they're kind of vulnerable for a little while, and you need to give your teeth some time before you start scrubbing. Some of the foods I think about with this is, you know, besides soda, hopefully we're not drinking soda anyways. The coffee and the wine are issues. But did you know carbonated water is actually a little acidic? It's like a pH of 3 to 4. And so still water is actually better in terms of managing the pH in your mouth. That's a really interesting one to me. And then of course we think about our citrus fruits, right? Now, I love lemon. I think lemon has so many health benefits, and I would hate for people to give up their lemon. But maybe we think about lemon cooking with it rather than adding it to our water and sipping on it throughout the day. That's really when we're, you know, that constant exposure is keeping that pH down in our mouth, and that's where we see the problems. So switching to still water, unsweetened teas are okay. Tea is slightly acidic, but green tea is less acidic than black tea. And green tea has tons of benefits for your oral cavity anyways. You know, helps with that inflammation of the gums and helps fight some of those pathogens in there. I always think of it as like a mouthwash, like drink a little and swish it around and get the benefit in there from that. So that's a great substitute for your coffee. If you are having coffee, throw some milk in there and skip the sugar. The milk will help to increase the pH, help to make it a little less acidic, I should say. And it also has all of the calcium and the phosphorus, and that phosphorus kind of creates a natural protectant for your teeth and can help to rebuild the enamel. So easy little hack there. And then once you're done, we're going to have acidic things, of course. If you have it, like I said, rinse with some water and then pop in a piece of sugar-free gum that uses xylitol. And the chewing helps to increase saliva production, which coats your teeth and helps to keep the bacteria off of them. So that's a great little hack as well. But let's talk, I don't want to take too much time for everyone, but let's talk a little bit on the personalized side. So Lisa, can we go to the next slide? Okay, we've got another poll here.
Yep, let me bring that up real quick.
Okay. I get to see it on my side. I'm not sure not. There it goes. Okay, so if you are struggling with bad breath, which form of soy is best to eat? Did you know that there is certain forms of soy that are worse for your breath than others?
Looks like tempeh is maybe going to be the winner.
Okay, I can't see it. I think I lost it. So you might have to tell me.
Oh, no, yes, that's fine. Totally. I'm going to end it and then I will, and I'll bring up the answers. Looks like we're done answering. Yeah, okay, good. I'm going to go ahead and end it.
Almost, yes.
Share the results.
Okay.
Results.
It's some would flip it, tempeh won. And I think that would be my instinct too. I would be like, fermented food. Yes, the answer is always fermented food, right? What's really interesting about this is that those microbes in our mouth, they use polyamines in foods to convert them into smelly compounds, right? These volatile gases. And tempeh is much higher in those polyamines than tofu is. So if breath is something you're struggling with, choosing tofu actually might be a better option for you than the tempeh. Also on top of that, tofu is a nice neutral pH and high in calcium, so you get some more benefits. But yeah, that's where we can look at what's happening in your mouth and say, okay, do you have these microbes, and are they really active in producing these volatile compounds that cause bad breath? And how can we kind of strip away some of their activity? Maybe it's by choosing tofu instead of tempeh. All right, let's go to the next slide, Lisa. Maybe I'll just give a couple more examples of how food can be personalized for your oral health. We've talked a lot today about those pathogens, the P. gingivalis and the S. mutans that can be in the mouth. And if you're testing your oral microbiome and seeing a lot of high activity in those pathogens, we might want to think about how many foods high in nickel that you're consuming. Nickel is actually used by those pathogens as a cofactor for enzymes that ultimately help enhance the survivability of those pathogens. So for a period of time, it might be helpful to minimize some of those things. And one of them is cocoa, chocolate, which just kills me. But also things like cashew and buckwheat nickel tends to be higher in some of our grains and nuts and seeds. So eliminating that for a little while may help neutralize some of those pathogens. One other example is our pH. We've talked about the oral pH a lot today. If the pH in your mouth is off and we want to make it a little more alkaline, we may want to get those oral microbes to produce ammonia. And if you guys are out there and you're like our biome community, you're probably like, what? I thought I am supposed to be reducing ammonia. And that's true in the gut. And that's why personalized nutrition is so interesting. Because in our gut, we don't want a lot of ammonia production by those microbes. It actually can damage our gut lining and impact our motility. But it's totally different in the mouth. In the mouth, the ammonia production helps to increase your pH, which we know has benefits in preventing cavities and neutralizing some of those bacteria. So if your oral cavity needs that support, we're going to look for foods that are high in nitrates, maybe like your beets or celery or arugula, things like that, to help bump up the ammonia production within the mouth. Those are just a few kind of fun examples. And with our full body intelligence test, we have that ability to look at your oral microbiome, and soon we'll be able to have that with a standalone oral intelligence test as well. So let's, Lisa, I think our next slide jumps us into going even further into personalization.
Yes.
We had some questions on this topic as well, probiotics in the mouth. So Hilary, maybe you can introduce us to that.
I would be happy to. A little bit of a teaser here. So with your Viome oral microbiome testing, you get your personalized nutrition program. And of course, you're going to be doing your oral hygiene routine that Loren recommended. Now, as an adjunct to that, Viome will soon be offering a suite of personalized oral care products. These are the first of their kind on the market, and they're made specifically for your unique oral microbiome to meet your personal needs. Now, the first offering to come in this line will be personalized biotic lozenges. So traditionally, our oral care products are made to reduce the bacteria count in your mouth, but you need good bacteria in your mouth. So our MyBiotic oral lozenges, they're called, they will help colonize your mouth with good bacteria and other ingredients that your mouth needs. So let's look at what's in these. So I mentioned good bacteria, probiotics. So these have a benefit for your mouth. One of the biggest benefits they can provide is reducing S. mutans growth. That's that bacteria that can cause cavities. Then there's prebiotics. So if you're taking Viome's precision supplements, you might already be familiar with prebiotics. These are fibers or non-digestible carbohydrates like fructooligosaccharides or inulin you might recognize. These serve as kind of the food for the good microbes in your mouth. It helps stimulate their growth, and turns out prebiotics can actually help freshen your breath. Who knew? And then there's postbiotics. What is that? Postbiotics are kind of the new kid on the block in the industry. Postbiotics are heat-killed or inactivated probiotics. And turns out they actually have a benefit for your health, especially for your oral health, your immune system. So we've picked out some very specific postbiotics depending on the needs of your oral microbiome that will help give you a benefit to your mouth, your overall health. And then in addition to those biotics, there's several other ingredients, food extracts, minerals, amino acids. Those are all recommended depending on the specific needs of your microbiome. There's also xylitol in there. Xylitol helps reduce cavities. And what's most exciting to me is not just what's in them, but it's also what's not in them. So I mentioned earlier, all of these things you should look out for in your oral care products. Those are absolutely not in there. In addition, you're not going to see any fillers, binders, any of those stearates, dioxides, the nasty things that are normally in these types of products that you don't want. So this lozenge, it's kind of like a breath mint. It's minty. You would use it after you brush your teeth, or you could really use it any time of day, but best to use it after you brush your teeth once you've removed all the bacteria from your mouth. And just let it dissolve, coat your mouth with this good bacteria. What's that, Janelle?
Not to plug it, but we've been lucky that we get to test these products as we develop them, of course. And I've never had such fresh breath as when I use these lozenges. It's amazing.
Yeah, they're great. So excited to get these out there. So soon thereafter, once we get these lozenges out, stay tuned for personalized toothpaste as well. We've all been working super hard on these. We can't wait to get them out into your hands. There's really never been an oral care line quite like this, where the products are made based on your oral microbiome, based on exactly what you need. So stay tuned for these products. In the meantime, we still have our full body intelligence test. You can get that on our website. Test your oral microbiome, test your gut health, your gene expression in your blood cells. That's available for you. But otherwise, stay tuned. We have new personalized oral care products coming your way.
Yes, stay tuned. I am super excited about that line. I cannot wait to try it. And that wraps us up for this webinar, for this session. Thank you, our audience, for joining us. We really, really appreciate you spending this time with us and learning more about your oral health and how you can create a routine that's best for you. And so I do want to obviously offer all of our attendees a special code. You can use MAR webinar, one word. You can use it if you would like to purchase a full body intelligence test and, obviously test your oral microbiome as well as your gut and your cellular health. It's $100 off when you use that code. It's good through this Sunday. And there's one more special thing that I want to extend to our audience today, which is you should get a follow-up email tomorrow, probably sometime in the afternoon. And this is an extra special thanks to everybody. So you'll get a link to the replay. Sorry, we have a typo there. Link to the replay of this presentation. So if you wanted to replay anything and learn about it again, you can. You will get the discount code that I just mentioned. And then also you will get a link to this, the Viome Guide for Oral Health. So it's written by everybody here on the team to give you the best recommendations that we feel for you to keep up your oral health. And it's a downloadable link. It'll be in a PDF format that you can just click on it and download it and keep it and take a look at it, in addition to this webinar and our other webinar on oral health. So thank you very, very much for attending today. We will see you once again very soon next month for our content webinar in April. And ladies, Janelle, Hilary, and Loren, thank you so much. This is a tremendous amount of very important information that you've been able to pass on to our audience. And I really, really appreciate you guys joining us today. So we're going to end off there. Thank you all very much. And we will see you all very, very soon.
Thanks, everyone.
Bye, everyone. Thank you.